Hospital recently visited Nigeria with a mission to educate healthcare professionals and the general public on the latest advancements in cancer treatment. As a renowned institution in the field of
Dr. Prasad. I'm
oncology,
a senior medical oncologist from Apollo Proton Cancer Hospital, India. So today it was a wonderful evening in Nigeria, in Lagos, with all the eminent cancer doctors from Nigeria. We had been looking at the innovative approaches wherein we can help advanced stage cancer patients from Nigeria. So we do have a wonderful interaction with the oncologists from Nigeria regarding how to integrate the newer forms of treatment in terms of the radiation like proton beam therapy, newer chemotherapy, targeted therapy, immunotherapy, robotic surgeries, theranostics, as well as diagnostic procedures in the management of cancer patients. An integration of a multimodality treatment with all these interventions is definitely going to be changing the lives of cancer patients, especially when the tumor is diagnosed in a very early stage, because we do not have much of the medical facilities in Nigeria. But there is hope. It's going to be a game changer, and we do have patients who are going to be like cancer survivors even when they are diagnosed with an advanced stage of cancer. So this is the crux of this particular meeting this evening in Lagos, Nigeria.
Proton Hospital shared its expertise on innovative methods and technologies that have revolutionized cancer care. The team emphasized the importance of early detection, accurate diagnosis, and personalized treatment plans in improving patient outcomes. During their visit, Proton Hospital also stressed the need for advocacy and awareness in the fight against cancer. They highlighted the significance of disseminating accurate information to the public, debunking myths, and promoting healthy lifestyles. By empowering individuals with knowledge,
My name is Dr. P. Sogranya. I'm the chairperson of the youth arm of the Nigerian Cancer Society, and I'm a doctor, a medical doctor, and future oncologist. Apparently, today's conference was very impactful. Apart from the typical management of oncology patients, we got to know other innovative management for oncology patients, like we were taught or we they spoke about immunotherapy and nuclear medicine in the management of oncology patients. And the urologists also spoke about other interventions in management as well. So it was really, really, really helpful, and I learned a lot. Okay, yes, we all have this typical belief that cancer is without cure. The moment you get cancer, you are going to die. But there is hope out there. The fact that there are new technology coming up and there are new ways of management of cancer, it shows that there is hope. So let's keep supporting and let's keep praying. And we, the younger generations, would hopefully do even much more better than the older folks. And we'll learn. That is why we are here. We are learning as a radiation and clinical oncologist in no distant time. Consultant radiation and clinical oncologist in no distant time. I hope to employ this new technology and innovative methods in treatment of cancer patients and different cancers as well, and even go into research to know more. So if I can do that, I'm sure there are so many other young doctors and doctors that will do that, and hopefully by the time that you can even guess what is happening, cancer will obviously have a cure, and the treatment will obviously result to positive results. And I'm even surprised when they mentioned something about a stage 4 patient with cancer having cure. So that means if this thing is going out there in the developed world, I'm very sure in Nigeria and other developing countries, something positive will happen. Thank you very much. Dr. Peace Ogaraya.
Proton Hospital aims to reduce the stigma associated with cancer and encourage those affected to seek medical attention promptly. In addition to cancer treatment, Proton Hospital's team also discussed the exciting role of artificial intelligence AI in the gynecologist department. AI-powered technologies are being harnessed to enhance diagnostic accuracy, streamline clinical workflows, and improve patient care.
I'm Dr. Ajibike Orekoya, a consultant clinical and radiation oncologist, currently the head of department of the oncology department in Federal Medical Center, Ebute Metta. Today's program was by Apollo Proton Hospital in India, where they were hoping to increase our knowledge about recent advances in the management of cancer care. I talked about the recent advances in the imaging techniques in oncology. Um, there, are, there have been different advances in the imaging techniques for oncology patients, which include advances in CT, MRI scans. Also, there have been advances in theranostics. Theranostics is the addition of diagnostic imaging with treatment at the same time. So then there's also been artificial intelligence, which has greatly improved the imaging of patients and also treatment planning.
For instance, AI-driven imaging analysis can help detect cervical cancer and other gynecological conditions more effectively. Proton Hospital's experts demonstrated how AI is transforming the field of gynecology and improving health outcomes.
I'm Professor Abayomi Durosimi Eti. Well, it's been made clear that the incidence of cancer in Nigeria, as it is elsewhere in the world, is on the increase. And also, we've learned from the symposium today the various methods, current methods of treating cancer. A lot of them seem so fresh and difficult, but at least at the end of it all, the hope is that one day we'll get there, and that we are not too far from reaching the standards being which countries like India, the US, or UK, and all those countries have achieved. So we have that hope, and I believe the young men and women too that were at the symposium, I'm sure they'll all be up to it. Now that a foundation has been laid here today, people are more aware. I think we need to sensitize the government officials in particular. And then we can let them see the evidence that this day and age, it is possible to track cancer, track the name of the father, the name of the mother, the name of the sister, whatever, and then you can actually kill the cancer by various means, which are very, very easy, apparently easy. And it seems every day newer things are coming up. And I think once we do this and we are able to demonstrate this fact, even the government itself would have to look for the money, because that is the major obstacle that we have. It's the money to try and get to this level. Having said that, again, we must not forget that as of today, at least in the area of cancer, that's what you call public-private partnership, similar to the one we have at the NSIA and LUTH at the moment, which is the model project. And this is being extended to about 600 hospitals in Nigeria from each of the 6 geopolitical zones by the NSIA and under MedServ. So that is a template on which we can actually develop and build and get more funding into this area of getting modern treatment facilities for treating cancer patients. I think all we need is public education, which has been done. Professor Abayomi Durosimi Eti.
Proton Hospital's visit to Nigeria marked a significant milestone in the country's ongoing efforts to improve cancer care and gynecological health. By sharing their expertise and experiences, Proton Hospital's team inspired healthcare professionals and the public to strive for better health outcomes.
I'm Dr. Habib Mohammed. I'm the Chief Clinical Coordinator of NSI Youth Cancer Center. Well, from this campaign, we intend to improve the quality of care. We're trying to improve, the standard of care to bring to light the modern treatment for cancer treatment, so that we can use more of personalized cancer therapy. The new therapy, which is personalized, will help in improving the acceptability of cancer care. That's the orthodox cancer care. It will also limit side effects for cancer patients, and it is also more effective. So we have better prognosis, better outcome of cancer treatment, and this will make more patients believe in coming to the hospital for treatment, and that will have effect of bringing them early to the hospital, so they present early, and that will also improve the outcome of treatment. Okay. Economic crisis and patient demand, we have to look into policies. We have to, push for policies that will improve insurance for cancer, treatment. Where I work, the NSI Youth Cancer Center, there are programs for the indigent too. We have a program that sponsor indigent patients for treatment. So, and we would like more centers to join that kind of project. Dr. Habib Mohammed.
As Nigeria continues to navigate the complexities of healthcare, collaborations with institutions like Proton Hospital will play a vital role in shaping the future of medical care in the country.
My name is Shivjit. I'm representing Apollo Proton Cancer Center, India. So basically, cancer is a curable disease when they come in the early stage of the cancer, when they're doing the right diagnosis test and radiology test. And so it can easily, in the stage 1, stage 2, the cancer can be eradicated. But we know very well that we're doing a lot of awareness event on the breast cancer, prostate cancer. When you have any significant symptoms on that, you please come and meet the doctor and do the test at the right time, so the cancer can be treated well. And so once that in cancer is go stage 3 or 4, it's very dangerous, so it will be not be able to cure the disease. This is a knowledge exchanging event within the doctors of Nigerians and also the Indian doctor, and also it is a learning for the upcoming doctors of Nigerians and those who are like residents and assistant doctors. And there's a lot of research and new technology coming in the cancer for treatment. And I'm coming from the background of Apollo Proton Cancer Center. It's one of the biggest cancer center, and we have a very latest technological proton therapy. It's the only hospital which have that proton therapy in entire Southeast Asia and Middle East and India. So we are very much advanced in everything, and also the in cancer, like diagnostics, like the reports are very much important. So once we do a biopsy or any reports, has to be get it done within 3 or 4 days without any delay, so we can start the treatment. This is a beauty in India why the cancer treatment can be started very immediately, because the report instantly we get it. The reports, that is one of the beauty why the cancer people has to come to India for that cancer treatment. See, the cancer, if you compare to India and Nigeria, India is cheaper. The cost is expensive, the travel cost. The people only think of the travel cost, but not about the technology, what we're using. And the medicine. The same medicines are made technology. If they go for the European countries or US and all, they're paying 3 times of this. Because India, it's very affordable and safe technology we're using, what the other developed countries are using. And coming to the medicines, most of the medicines will be manufactured in India. Is much cheaper than any African countries. So what we do, and also the PET CT, everything, and basic evaluation for the cancer like PET CT and histopathology, everything will be done in $1,000. And most of the patients, what we advise, if after coming to India and they are doing a PET CT and other diagnosis tests, so once they decided for the chemotherapy, targeted therapy, or any other treatment, so what we do is we will tell the patient to take the medicine from India and continue there. It's very much affordable for them. My name is Shivjit. I'm representing Apollo Proton Cancer Center, India.
Yes, this is quite popular in Eastern Europe.